So now you can see this is the intertragic notch. This is the tragus, this is the antitragus. This is the tragus, this is the in front of the ear, that to be known as this is the flip. So this is the cartilage, strong cartilage. This to be known as, you hold like this, you can recognize there is a cartilage. Tragus. So this antitragus, the entire region to be known as a brine system. Right. This is a frontal brine. This is a vertex of the brine. This is a occipital brine. This is a temporal brine. And this also another temporal brine that is on the inside. This on the right side of the temporal brine. This is the left side of the temporal brine. Temporal lobe or the temporal lobe. But now I'll repeat once again. This after the intertragic notch, you can find the antitragus. This is a tragus. This is a antitragus. This is the prominent. You can see the prominent. The prominent to be known as a pai hui, that is the DU20. Just below to that region to be known as a shantang. So this is the frontal head. Shanting means is the DU24. Good. So now you can see from here is the frontal head. This is a parietal. This is the vertex of the head region. This is a occipital region. Now I wanted to apply 1, 2, 3, 4, 5 points to treat for the brine related disorders. Now let me see. I just apply the points on the frontal head region. Yes, further I just apply the points for the occipital region. Right, now you can recognize the frontal lobe and then occipital lobe. Midway between these two we have the parietal, the top of the vertex. This called as a sagittal plan. Sagittal plan on DU20 points are located on the center point of the cerebral cortex of the brain. Then further you can see there is a temporal lobe where exactly the point called as the Shuaigu, that is the gallbladder 8 point is located on this region to treat for the auricular related disorders. But now the frontal lobe, the called as a forebrain. Forebrain is treatable for all the cognitive functions and also language, and further there is intellectuality and also movements of the muscles to be taken place by activating, because the prefrontal cortex region, this is the really important. The central sulcus, the anterior to the central sulcus, that area to be known as a frontal lobe. And further the parietal lobe is the somatosensory cortex area, this to be known as a central line. The posterior side of the line, this called as the last one is the occipital or the visual cortex of the brain, that's called as a V1, V2, V3 region. The points are located over this region. This point also to be known as a MN and then Feng Fu, that is the DU15 and then DU16. The points are going to end over this region. Then further we can see the points called as the Shuaigu, that is the temporal region, GB8 region, inside and outside. This is the right side of the temporal lobe, that inside is the other side of the temporal lobe. So in this way all the brain related problem can be treatable. Do you have anyone having the doubts? Because what are the function of the auditory function to be taken place, the limbic system to be taken place by the temporal lobe, right? So in this way the pain related condition is there, that time is the somatosensory cortex area, where the parietal lobe is very important to treat for the sensory areas. And further there is the motor functions to be taken place, especially on the frontal lobe region. Right, this is the motor cortex, this is the parietal cortex for the sensitive region, this is the auditory cortex for the limbic system and also for the auditory system, this is for the vision system. The entire region to be covered by activating this point. Whenever you wanted to treat some of the points on the brain related condition, you just add up the points called as a Chusa. Chusa is the pericardium 3 or the Chung Chung, the pericardium 9 point is advisable. Along with that you wanted to add up these points as a auriculotherapy. Obviously you can use it this point. Further, previous week I told you for the cerebrum and cerebellum can be treatable. So that points you just use it, the points called as a, that is on the frontal lobe. You can just apply the 1 point is the cerebrum and then cerebellum on the other side, and also basal ganglia. Remember in the Yamamoto new scalp acupuncture 3 points are located. 3 points together you wanted to add up that as a the brain points, 3 points, along with that is the scalp acupuncture points, along with that ear points, and then is the body acupuncture points called as pericardium meridian, also to be known as a the brain points. So you just activate. See, the person will get the relief with the auriculo, let it be really good, or he will going to get effect through the central nervous system directly by using the points called as a brain. You just use it, or you wanted the body acupuncture will going to accept. In the trinity level, you are using the points. One or other way will be going to affect our body system. Obviously, patient will get maximum recovery to be taken place, because you are not using targeting in one area. In the triple area you're using, maybe sir it will going to overactive of the brain, it may causes. Better is I recommend you don't use all the three directions in at a time. Better you can use it one point auriculo in one particular moment or one particular session, you just do it. Later you just do it sometimes you just use the scalp acupuncture for the second sitting onwards. Third sitting you wanted to add up as a brain points is good, or you wanted to use the brain points, that means is the hand points, you wanted to use pericardium, you just use it. And also one integratedly add up auriculo or the scalp is advisable. Hope you are understanding, isn't it? Yeah, all the psychosomatic and mental related disorders and anxiety, depression, insomnia, stress level today is the predominantly is happening to the people. Even that condition also randomly you just use it, because we don't know the limbic system is affected, or the amygdala is affected, or the hippocampus is affected. But all the conditions, obviously sometimes you just add up, this will be helpful. Yeah, hemiplegia, paraplegia, quadriplegia, tetraplegia, all these conditions also you can apply. Maybe we don't know which area, but you wanted to use it, you just use it. Mostly on which side that is affected, accordingly you just plan it. But randomly you wanted to apply this point is good to treat for the hemiplegia as well. Thank you. Just